This question says, which of the following is not a method for obtaining a patient's respiratory rate? So a reminder that we're looking for which answer is incorrect. Option A states counting breath for 1 minute. And that sounds accurate. You're going to be counting how many times they breathe in a minute to measure their respiratory rate. That would be kind of like the definition of measuring a respiratory rate. So we could eliminate option A because the answer is asking which is incorrect. Option B states using a pulse oximeter. And when we use the pulse oximeter, we could see the patient's oxygen saturation level, and sometimes the device might also state what their heart rate is. However, usually the pulse oximeter will not measure what the patient's respiratory rate is. And since the question is asking which is incorrect, it looks like we're going to be going with option B for now, so I will circle that, but let's look at the other choices. Option B states observing chest rise and fall. And that does sound correct because when you're measuring a respiratory rate, you're watching for the chest rise and fall to determine each breath, and that's how you measure the respiratory rate. And since the question is asking which is not correct, we can eliminate option C as well. And then option D states listening to lung sounds with a stethoscope. And yes, that's another method that you could use for measuring respiratory rate by listening for how many times they breathe in and out within the minute. So we can eliminate that as well, since that is correct, and the question is asking which is incorrect. So that leaves us with our original idea of option B, using a pulse oximeter. That's typically not a method used for obtaining a respiratory rate in a patient.